Good morning, everyone. Welcome to what month are we in? February, Brooklyn DD Council monthly meeting. Hope everyone is doing well and thawed out after last week's cold. Can't say I missed that while I was away. So we have a pretty big agenda today. We have updates from OPW. I have an update from IAC. They still don't have anyone to join us yet, but I think Winnie said they will have someone back next month from IAC on their behalf. But Winnie did provide an update for me to give to the group. And then we also have two presentations. We have a presentation from Gym Guys and how they support the IDD population with different activities and fitness. And then we also have a presentation from Aisha Green from Children and Youth with Special Health Care Needs program at the New York City Department of Health and Mental Hygiene. And then of course at the end we will have time for announcements. But again, please make sure to put any announcements in the chat as well before we get to the end, and everything will be posted on our website. So to kick it off, the first thing is if you have not registered for the upcoming 5-borough legislative breakfast, please do so. I've sent out regular emails. It's on our website. I'll send it out again after this meeting. But you have to register. Is it next Thursday already? It is next Thursday, March 6th at 10 a.m. on Zoom. And if you do not register, you will not get the link to log in. You have to register with the email you plan on signing in with, just to ensure that everything goes smoothly. That's the way that it works best. So if you need more details or information or help on how to register, please let me know, or Rochelle or Chris or anyone, and we can assist you with that. But in the emails on our website, please use that link. Use the email you plan on signing in with. We will start at 10. I believe we will hear from OPW's commissioner. There will be all the boroughs there, a number of elected officials. It'll be a great event like the last few years as well. In addition to that, tomorrow there is a NIDA rally up in Albany. So that should be a good event, and advocating for the budget, and the requests haven't changed since our last update. Targeted inflationary increase of 7.8%, creating a wage commission to make recommendations to increase direct care salaries, returning OPW rate setting from DOH to OPWDD. And we'll talk more about that, I'm sure you'll hear later on in the agenda. Any other updates, news, council chairs, you want to talk about meetings that you've had since our last monthly meeting? I see you
Brian,
guys.
Brian, this is Chris. Debbie's trying to unmute. She's having a little issue.
Okay. We have a number of our co-chairs here, so please feel free to jump in and give updates
I
and
raised my
drum up interest.
hand.
Go ahead, Debbie.
I was just raising my hand, Chris. Good morning, everyone. First, I want to announce that the Provider Family Information Committee met on February 12th, and our speaker was Michael McKinney from Goodwill. He talked about the janitorial work program that they have, how they do it, and how it's going to be. Then the next meeting for that committee will be on this, again, March 12th from 10 to 11 a.m. I don't have the name of the speaker yet, but please check the Brooklyn Family Support Advisory Council's website as well as the Brooklyn DD Council's website. Want me to do I'll do the advisory quickly. We
Sure.
had our, we had our, not on a regular day, we met with the 4 other councils. We had a joint meeting in reference to the Ombudsman program that's been set up for OPWDD. It was very well received, and they explained that it's not just for New York City, it's for the whole state. But they're starting here in New York, but they're doing whatever advocacy help they have to do in other parts of the state by video. So that went very well. The next meeting for the advisory is going to be on Tuesday, March 18th. Now, we did also have our resource fair this past, the 7th. We were at Greenpoint Library. It was very well attended. Our next one will be on Friday, March 14th from 11 to 1 will be at the East New York branch of the Brooklyn Public Library. The Brooklyn Advisory Council's meeting will be on March 18th, and that will be from 9, try to get on by 9:45 to 12. Also, want everybody to know that the statewide Family Support Service Advisory Council will be on Wednesday, March 5th. If you want to speak at the public session, once we get the information, I will see that it's shared with Brian and Christopher to put on both websites. So that's what's going on with the Advisory Council and the Family Provider Information Committee. Thank you.
Thank you,
Madam
Debbie.
Chair,
Carrie, do you have a question for Debbie?
yes, and as well as Chris, because we're both going to say the same thing. Go ahead.
Yeah, it's actually not at the East New York Library. It's in East New York at the New Lots Library. I'll put the information in chat later
You're
on.
right.
Yeah.
I read it wrong. Sorry.
No,
You're
that's
right.
all right.
It
I
is the
just
New
don't want,
Lots Library.
right.
But
I just don't want
it is
people.
in East New York.
It is in East New York. It's a great library. It's big. It's got lovely spaces, and we're building a garden. Yeah, that's where it'll be. I'll put the address and everything in the chat soon.
Oh, and also if any agency, as we have said before, if we don't have enough space for you to have a table, still should come by and leave your information with us, because Carrie, as well as us, we share your information through all the libraries in Brooklyn, as well as the Brooklyn Advisory Council, and we share it with Brian, who puts it on the Brooklyn DD Council. Thank you for the help in correcting me,
Sure.
Carrie. Thank you.
And if you do send me, if you can't be there and you do want your material there, if you send it to Chris or me in advance, we can put it on the information table, the general information table.
Excellent. Lucina, update on the legislative committee?
Yes, good morning, all. Such a beautiful day today. It is. That's that freezing. Well, we had an amazing the Black Caucus event. We were able to be there, and the greatest thing is that we were able to I sat with the Governor's Parent Association with Miss Willie Mae Goodman, and we had the commissioner there, personally met the commissioner. She was there, the new director of the Justice Center, Dee Levy, the other director, and also many legislators were there present at that event. So we were able to get some good information. And I think our new commissioner, which is our acting, I think her heart is really in this. So let's see what happens with her. We're running the helm, holding the helm of the OPWDD right now. Maria and I we were so fortunate to speak with Brian Cunningham. We had a Zoom with him, which he's really excited about joining us and speaking at the legislative breakfast. Also, I'm still in contact with Hakeem, so they are working on something, hoping, because he should be traveling, but he would be hopefully present. Thank God it's Zoom, so he can appear on Zoom. I spoke to Farah, which is one of our city council women, too, very interested. Monique, I contacted them. I'm just doing another reminder with them this week to make sure, because as with our electives, you have to constantly reminding them because their schedule sometimes doesn't always fit in with ours. So Maria was there in Albany too. We were really connecting and meeting, but the best thing was having to sit really with the commissioner and talk about our concerns and what they can do, because apparently there's a lot of money in the budget for OPWDD this year. So let's see what happens, where it is going, because a lot of families were there with concerns to the legislators and the commissioner about, the state of the residents and all the DSPs and their payments and, educating them as much as possible. Because Ms. Goody, I love about Ms. Goody, because she really speaks to these legislators about what it is and how can we provide for our families. Maria there was a really excellent conference and workshop. and parent involvement. So we are continuing doing that. Again, as parents, one thing as providers, we have to make sure our parents understand that connecting with legislators are very important, knowing that they live in the community and the legislators want to hear from the parents. We have to continue doing that. So Maria, you want to say anything? Because she was there at the event as well.
Yeah, thank you, Lucina. Just to add, Senator Rodell Clear was the one who sponsored that workshop, and she gave us the room and the opportunity to be in the space to bring everybody together. As Lucina mentioned, it was wonderful speaking with the commissioner and the deputy commissioner, John Barbuto.
Yeah.
Yes, he was also in attendance, and it was a good discussion. There was family members, individuals who spoke as well and had questions, and response was received. We spoke at length about the Justice Center and how they function, and the Executive Deputy Director, Maria Lisi Murray, was in attendance, so she was able to answer some questions. And to conclude, basically, our legislative committee meeting was on the 12th of this month. Next month, we're having it again, March 12th at 11 a.m. We are trying to still get legislators to attend our 5 borough virtual legislative breakfast. The Assembly member, Ranis Bishad, will not be able to attend, but she promised to give us a video, so I'll be getting that on Thursday. And that's it for me. Thank you.
Thank you, Maria. It's so
You're
good
welcome.
teamwork. Yeah, it was amazing. But we'll have some of these discussion because one of the things, Ms. Goody, what even though the commissioner for OPWDD commissioner was relating, we need to have our parents having conversations, because the only how we can have changes or transformation is hearing from the families what they're experiencing, whether with their DSPs, whether with the services they're receiving. It's vital for them to know, because most of the time parents will be going through crises with different situations, especially in the residentials, and they're afraid to speak out because they're afraid of the backlash, what might happen. So that is encouraged. Please, one thing that we want to make sure, our legislature will not give money to your agencies if you're doing the wrong things. And that was a major concern department with the Justice Center. A lot of things are happening and people are not speaking, and they don't know what's happening unless you tell them. Then we wait till when it's major crisis. We can't do that. We have to be honest as providers also. If something is going on right in your agency, especially the way you treat the individuals, we need to be honest. People are humans, and we need to treat them with that respect. So I'm looking forward to that connection with the Justice Center and the commissioner, doing some more conversations with them and how we can do, and also about supporting our DSPs and the people, even the provider agencies, and making sure we get the funding that we need to do the work that we cut out to do. So it was really exciting. I'm looking forward to the meetings with the commissioner more and the Justice Center, Miss Maria. I mean, exciting, was quite exciting. Maria, thank you for being there to witness the excitement and the conversations, which was so powerful. So thank you, Accountant Maria. We'll see you on March 12th. Listen, we appreciative of the Legislative Committee and the amount of people and their opinions and what they're sharing. So thank you all for being a part of that.
And one last thing, just as a reminder, tomorrow is the new we're having a rally at the Capitol. NIDA is basically sponsoring it. So I know there are several organizations that might have buses that will be going tomorrow morning. So more information will be put in the chat. So, but we're having a rally in the War Room tomorrow at 12. Thank you. In Albany. Thanks.
And that is a rally hosted by NIDA. Yep. Thank you, guys. Chris, you have a question?
No, just want to do my report.
Oh, okay. Go ahead, Chris. You can do the MTA report.
Yes, good morning, everyone. As I'm going to keep my camera off because I have a sign that says, "The future accessibility rides with us." The reason I'm going to keep this sign up because, to be very clear to everyone, the congestion pricing for people with disabilities is still going through. As I'm actually listening to the MTA at the same time at their board meeting, we have reports of more accessibility stations will be added in to the list. It's not just 23, it might be 60 more. And we're not just talking about the subways, we are talking about the railroads and other things coming up. We do have a pilot that's going up right now that's located at certain customer service centers, as well as the excuse me, and the and reduced vehicles and some railroad stations as well as Metro North stations. All this I sent it to Brian, which he'll send it out. The other thing we do have coming up this coming Wednesday evening, as MTA is doing their annual ADA accessibility, possibly announcing stations or certain things. It is, I already put it into the chat. You must, if you are attending, 6 p.m. to Broadway, 20th floor, please register to RSVP in person. Again, this is the in-person only. So I will remind everyone. The other thing is we did have the Omni Reduced Fare presentation. There is a video that was sent out. That video will give you opportunity to know how to sign up for the Omni Reduced Fare or how to deal with Omni card itself. And I am going to remind everyone to please remind all agencies, parents, and everyone, please make sure that you are aware that Reduced Fare MetroCard one by one will disappear and Reduced Fare Omni will take over. We are reminding you all that the Omni Reduced Fare will give an opportunity and some updated changes that will still get you on the bus to subway, subway to bus, and bus to bus. Accessory will be coming soon. As you know, there were 86 people testing it. Out of the 86, 3 of them actually are here. Brian, someone is unmuted. And as I was saying, it is being tested. Anyone who is an Accessori user will be getting a letter, and you will be using the Omni AAR card and the Omni Reduced Fare. So the question I've been saying all these months, can you use 2 cards in a one account? The answer will be yes, because they're both traveling cards. So please remember that, because if I ever ask you that question, you got to pass the test on that. I will be here for a little bit, but if you have questions, please email me at chrisgreif@yahoo.com. As a reminder, as Carrie already put it onto the chat, the reduced fare will be joining with us at the resource fairs. And when we do have the family support fair, they will be joining with us as well. If anyone has any questions, I don't know if Lucina has a question for me.
So her hand is up, but she stepped away from her computer.
Yeah.
All right. I don't see any other questions for you, Chris. Thank you for your update.
Not a problem. And oh, there she is.
Lucina, do you have a question for Chris? I see your hands up.
Oh, no, I need to raise my hands down. Thank you.
Yeah, I thought I was
Thanks.
going to say, Lucina knows how to find me faster than a needle in a haystack, as well as Denise Jordan, who was hiding. So thank you, everyone.
She's listening.
All right. Thank you, Chris. Is there anyone from the Meaningful Day Committee that wants to give an update? All right. So at this point, I'm going to
Good
pass it
morning,
on.
Brian. Hi, sorry. Good morning, Brian. Good morning, everyone. This is Melissa, co-chair for Residential Committee. I just wanted to announce that our first meeting will be on March 14th, 2025 from 4 p.m. to 5 p.m. And the flyer will be going out today, which will include the Zoom information.
Oh,
Future
excellent.
plan. Yes, and we apologize. Markham and I did try to meet a few times since we were appointed. However, for several reasons, we weren't able to meet, but we did actually meet on 2/4, and we decided that the first meeting will be on 3/14. Some of the future topics that we do want to discuss, housing fairs, housing subsidy, self-direction, simple homes. We also maybe wanted to provide an educational session for the CCOs. Talk about the front door and also COMPAP services for people who may not want to attend a traditional day program. So those are some of the things that we are thinking about discussing in our future meetings.
Excellent. So as you heard from Melissa, our residential and housing committee will be getting off the ground March 14th. And Melissa will get us the flyer and I will blast it out to everyone and get it on our website for everyone that is interested in attending. Thank you, Melissa.
Thanks, Brian.
Marjorie, do you have any updates for the Meaningful Day Committee?
Morning, everyone. Please forgive my voice. I'm a little bit under the weather. We had our first meeting. It was very well attended. We are actually doing a workshop series on transition services. That next meeting will take place, I believe, on April 6th. The meeting we had in February was attended. What I say on that kind of foundational support services are out there. Transition. I'd love to see more. I think that was
All right. And I know they make wonderful flyers. So once I get the flyer from them for the next meeting in April, I will send it out to everyone. And again, Meaningful Day, that's the newer committee where we kind of combined transition, children's services, employment, and it covers the whole lifespan for someone that needs services and transitions and everything that goes into proper support and a meaningful life for a person with intellectual developmental disability. All right. I don't see any hands or any questions, so I will pass it to Nina at OPWDD for the OPW update.
Good morning, everyone. So I have a couple of things today, and I'm going to start with a proposed New York State budget, executive budget. Governor Hochul, again, this year demonstrates her commitment to improving the overall quality, availability, and cost effectiveness of community-based, person-centered services for people with developmental disabilities. In her executive budget proposal, she provides new resources to address critical needs and supporting important policy reforms. Her proposed budget would increase New York State spending on OPWDD programs by roughly $374 million to nearly $5.5 billion. And that is excluding the local share Medicaid adjustment, which represents a 7.3% increase in the net new investment in the OPWDD delivery system. Following a historic investment of over $850 million in July 1st, 2024 rates, the executive budget invests over $154 million to OPWDD to improve the ability of the state and nonprofit sectors to recruit and retain essential frontline direct care workers, support and clinical workers. And the budget will include $116 million to provide a 2.1 inflationary increase to increase reimbursement levels, and an additional $38 million of state funds, and that would be a $76 million in all shares to support minimum wage increases, including indexing maximum wage to inflation for staff at programs which are licensed, certified, or otherwise operated by OPWDD. Since 2022, the state has made more than $3.9 billion available to nonprofit providers to support investments in the workforce, and about $1.4 billion in a one-time federally approved bonuses, $1.3 billion through 4 consecutive initiatives that recognize inflationary rates, and $850 million infusion to fund July rates, rebase reinvestment as of July 1st, 2024. Governor's budget also invests $16 million in new state resources to support OPWDD priority program reforms that allow people to receive the supports and services they need. And that includes people who are entering the system for the first time and seeking services, people who are already in the system but whose needs have changed, Costs associated with people who have aged out of the educational program in both state and out-of-state residential schools, reimbursement for new specialty hospital programs, and updates to property and transportation costs. With regards to housing, the proposed budget includes $15 million to expand independent living opportunities for people with developmental disability. And since 2016, the state has invested $140 million in capital resources to develop safe and accessible residential opportunities. And this year's budget raises the investment to a total of $155 million. I mentioned in the last meetings that also we are investing $75 million into Institute of Basic Research in Developmental Disabilities. The funding will support a genomics core facility that will provide customized identification of underlying conditions and establishing a Willowbrook Center by learning and transforming Building 29 on the Staten Island campus to recognize the historical significance that former residents of Willowbrook and their family advocates had its sparking New York State disability rates and influencing the whole system nationwide. And this is the biggest and largest financial investment to this institute since its opening in 1968. The executive budget also invests $25 million to establish regional health clinics to enhance access to health services for people with developmental disabilities. The budget has a proposal to double the maximum tax credit for businesses who hire people with developmental with disabilities. So that is from $2,100 of tax credit to $5,000. And this builds on New York's Employment First initiative in ensuring that everyone who wants to work is offered the opportunity. As you know, our agency has been working on expanding our focus on advocacy efforts in acknowledgement of the importance of the voices and experience those who receive services from OPWDD and their families. We have created a new advocacy services office which reports to the commissioner office, and this office is led by a new director, Lisa Salami, who joined OPWDD a couple of weeks ago. This office will lead the peer specialist program and also will work together and oversee the ombudsman program, and will focus on their advocacy efforts. So, and I'm going to move on and mention quickly about two other initiatives that OPWDD is working on.
Before you go on, is the person's name Lisa Salami or Lisa?
Yes. Hold on. Lisa Salami, she's going to lead the director of advocacy services.
It's coming up in the closed captions as Salami, S-A-L-A-M-I. Is that her name?
Y, S-A-L-A-M-Y.
Y. Okay, thank you.
You're welcome. Okay, so OPWDD, we are working on a day in community habilitation initiative. We are working closely with Oliver City on a human services training. The project is going to be a free statewide training program in partnership with our agency to educate direct support professionals, job developers, job coaches, and managers of employment opportunities as they support people with IDD to fully participate in their communities through the employment. So OPWDD, we entered into a 2-year funding contract and working with the Oliver City on job readiness training for day service management and staff. The purpose is to train rehabilitation service management and the staff to teach interpersonal skills, safety skills, build independence, and increase community engagement to better prepare people for work. The training will be delivered by Oliver City and will include examples of people with a variety of skills of abilities and who are working on their road to success. Management and staff will learn about the various employment and vocational services options and how to transition people to these services in a timely manner. And we realize that currently rehabilitation agencies have challenges of giving up or freeing up staff from direct supports to attend new trainings. So OPWDD is developing strategies to incentivize sending staff to trainings and developing executive leadership and training with the remaining funds allocated to this project. So that is something in the works, more to come soon. Another initiative I wanted to mention is that, as you know, the annual report OPWDD annual report was released last year. One of the goals is short-term goals for housing, and OPWDD is addressing this by, we have announced Community Transition Initiative. It's a one-time funding that we are offering to the agencies, to transition individuals who are in residential schools. They have graduated and they do not have a planning provider. We are offering a one-time incentive. There is also incentive for individuals who are in the hospital, that they've been in the hospital for several months, ready for discharge, but are not able to transition. For various reasons, we have the funding would be available for Willowbrook individuals who are in nursing homes, but expressed the desire to return back to the community. And also the funding would be available to individuals in ITO. So it's a one-time, as I said, funding opportunity. It's time limited. We held the webinar 2 weeks ago. Providers, the applications at the stations were due from the agencies last week. There would be a selection criteria for the providers to participate in this initiative. The agency must be in a good standing, programmatically and fiscally. And they need to be in compliance with the CFR reports. They cannot be on the early alert. So hopefully, the agency must have an active, viable vacancy to place the individual. It's expectation that the age-out students would be placed by October 31st. Individuals who are in the hospitals, ITO, and nursing home would be placed by July 31st, if I'm not mistaken. July 31st, yes. And we have received the attestations as of last week. OPWDD will review the attestations, will approve some of the agencies, and we will notify providers in the beginning of March. And hopefully we will start working and meeting and screening packets in the second half of March, I would think. And lastly, I would like to mention today, just to remind everyone once again that Georgetown National Center, they continue to offer family sessions to the families throughout the year. The sessions are offered through WebEx or by phone. There is an incentive of $25 that the family will receive after the completion of this session. As I heard someone was speaking earlier today, that change is important and feedback is important. And in order for OPWDD to change our system, we need to hear that feedback. and insights from the families and their experience with OPWDD system. So please spread the word. And this is for the families who are new to the system, who are receiving services, who were receiving services in the past. Please encourage families to join these sessions as George Town National Center. They are collecting the information, they are analyzing, and they will be providing their reports to OPWDD. And that's it for me today.
All right, thank you, Nina. I see we have a few questions. Rochelle, I saw your hand.
Yes, thanks, Brian. And thank you, Nina. This was really interesting report this morning. Thank you. And a lot of new initiatives from OPW that seem very positive. Just a couple of things. One is, would it be possible for the new director of advocacy to come to one of our council meetings?
All right, that's an interesting question. I think I can pass that.
Okay. I think we would all be very interested in hearing about her plans and about this new initiative. Secondly, I'm also, very grateful for the money that the state has put into rebasing and certified provider rates. Just a note that, of course, other programs in our system did not receive this increase, which is why we are advocating for a larger inflationary trend factor of 7.8%, so that we can try and catch up overall. But we are grateful for that money. But one of the issues is, again, the DayHab training program sounds wonderful. My son attends a DayHab, so I'm very interested in this. But the main barrier that has been for implementing some of these projects with the DayHab is trying to do is inadequate staffing. So it all ties back to the budget. And even though we've seen gains under Governor Hochul, I just want to share that there's still tremendous workforce shortages in DayHab programs and residential programs. So hopefully this money will help, but it's still a revolving door of staff coming in and leaving. But I do applaud the training because it's very necessary. One last point is I am pleased that OPW has improved access to data on its website. I think it's very good, and I think people should take a look at it because you can really play with it, and you can find out how many people in Brooklyn are receiving what services and what their ages are. You can break it down, you can refine it, and it's not hard to use. It's pretty user-friendly. So this is a great leap forward in OPWDD's data. However, I want to make one comment, which is that the demographic categories that OPW is using are the same as the federal categories, but they're very broad. Using the category Black is not very helpful for those of us here in New York City when the Black community has so many components. And how can we evaluate if we are adequately serving our Caribbean, English-speaking Caribbean community, Haitian community, other communities, if we don't have or there's Asian, and again, the Asian community is very diverse. So I actually wrote to the OPW mailbox, never got a response. I wrote twice. I wrote to Ms. Tucker, also did not get a response.
Okay.
So I'm asking you to convey that as something that I think is very important. And I know it's hard to do. It's not an easy data refinement, but if we don't start, we'll never finish. And I think it's really important for those of us here in Brooklyn and all the boroughs and all over the state to really have a better handle on this information. So that's my last request, and thank you again.
Thank you. Thank you. I will pass your comments to the leadership. Thank you.
All right, and Nina, you have another question from Ellen.
Good morning. How is this information about transition being given to the schools and to the students? When I work with families, for the most part, half of them never hear about transition until the kids are 21. How are you getting this information into the schools so that kids at 16, 17, 18 can be making some real choices, or their families can be making some real and informed choices? Nothing is more important than settling your child. Really, I mean, I don't mean settle for the hell of settling, but certainly to see a path for your child. And this information doesn't come to the schools. The CSEs don't get the information. The CSWs don't get the information.
So the funding that I was talking about is for kids who are in residential schools in and out of state.
I know you're talking about that. I'm talking period about transition.
About the transition from New York City system, educational system is, I guess, I don't know if Lucy Mazzi is on from the regional office, but we encourage to work with the care managers as soon as possible. You know, as soon as the person is available to join the CCO, and work with the care managers on identifying the birth services for the individuals.
Maybe I should be more specific. Does OPWDD reach out to schools directly?
We can, I believe we participate in school events whenever we get the invites. And I may, for the next meeting, I may ask to come, someone from our office, from the regional office, to come and talk about us anymore, because this is not my functional responsibility. So I'm sorry if I cannot answer your question fully.
Thank you.
Thank you. Chris, you have a question?
Yes, I'm going to be quick because I got to get ready to speak. Nina, with a lot of this information that you're getting, can you please, can you hear me now? Because I know I see your face looking at me strange. Can you, whatever information you brought in today, can you please share that? Because I heard you, but you did go off and on some words, and I agree with Rochelle what she's saying, as well as Ellie. But we definitely this year we have been working very well with a lot of outreaching, but we do need a little more communication, because a lot of the families have been saying, what is OPWDD's role in Brooklyn? I have seen the other boroughs more, but I think in Brooklyn, I think since they do attend our resource fairs and they have been doing a fantastic job, I just think that, and I know Debbie's going to chime in with me in a second, and hi, Lucy, I can see you there too. I just think that some of these questions that we still want to make sure that schools, because remember, a lot of transition school staff have moved, have proceeded, and they still don't get enough education to know who we are. So I think Brian and Debbie, we definitely need to bring it up a notch to let them know what the councils are and OPWDD know. Thank you.
Thanks, Chris. Debbie?
Hi, Nina. Nina, one issue that has been a major lack of help with is the Department of Ed has placed many children with developmental disabilities into a 10-month special ed program, not the 12-month where they go to like the transition centers. And many of those students are for the schools, I'm talking about community special ed, have tried to graduate the children at age 18. And I will just use the high school my child used, and would send all these students to go to YI, which had an office on Nostrand Avenue and Avenue T. And they one time asked me what's going on, because they knew my son went to the high school. And I said, because they refused to read that if they're not getting a Regents diploma, because that's what it is now, that they said they graduate, but they can't get a job, they can't do this or that. And they're supposed to keep them till age 21. So this is something that has to be constantly looked at and monitored, because I'm only going to talk not just for Brooklyn, but it happens in all 5 boroughs. The minute they place a child who is showing signs that they may be able to they think they're handling the they can do all this stuff. And then what happens is that the child cannot follow through. They don't have the correct work skills or social skills, and they're set up for failure. So there's a way we need to get into the non-district 75 schools, because that's where the kids are falling through the cracks. And we have to start doing something. I did it when my child was in high school, but not everybody is taking it seriously. And that's where we're going to have more issues and problems. So we have to figure a way to work together to work on this issue. Thank you.
All right, Nina, I don't see any other hands or questions for you. So thank you so much for your update and your time. We appreciate it.
Take care.
All right. Next we have the update from IAC. Like I said earlier in the meeting, there is no representative from IAC, but Winnie did share with me some notes to share to the group. And we're hoping with some new hires that they have that IAC will be back and represented in person at our next meeting next month. So some quick updates from Winnie. As a reminder, we talked about this already. Tomorrow is the NIDA rally up at the Capitol. And some of the talking points, as we've already discussed, the 7.8%, I was going to say rate, but I know we're not using that term, the targeted inflationary increase, 7.8% for nonprofit IDD providers, and include CCOs as an integral component of service delivery. Human Service Wage Commission convene a wage commission to study the adequacy of direct support wages and recommend a multi-year strategy for achieving a livable wage for those essential workers. And then in regards to rate setting, restore rate setting authority to OPWDD from DOH to create efficiencies and improve rate setting responsiveness. So in terms of the OPW world, those are the three main asks. Then turning to the SED, tuition increase, growth 3.2%. Include funding to support students continuing through the end of the year they turn 22. Continuation of the modifications to the current rate methodology until a new rate methodology is implemented. Those are their three asks from the SED. And then EI, early intervention, 5% rate increase. Implementation of the 4% increase for underserved areas that was approved in last year's state budget, retroactive to 1/1/25. And then when he said IAC will share their budget priority paper with all the councils prior to the legislative breakfast event next Thursday. And I believe that did come out, so I will share that after this meeting. Other updates from IAC, with the uncertain federal situation, while we are not the stated target of cuts, actions could affect our programs. IAC will keep info flowing on potential threats. For example, FAA DEI hiring target in response to the recent crash, including people with IDD. NIDA is planning to reach out to New York delegation to discuss support for our people and our programs. And as always, we strongly urge you to contact your congresspeople, especially if you're Republican, to make them aware of the issues. I mean, contact Democrats and Republicans, but we know at current time we have a lot more Democrats already on our side that attend all of our events. So we really need to get the word out and the messaging out and try to get people on both sides of the aisle on our side and understanding the impact that this can all have with everything going on coming from the feds. OPW's commissioner is coming to IAC on the 19th. Nope, that passed. Sorry. She sends these out in the beginning of the month, so I'm trying to weed through what's happened and what's not happened. There is a rally in the Valley on 3/7. Again, another advocacy event. Media coverage is ongoing. Check out NewYorkDisabilityAdvocates.org for the latest updates. They also post their one-click letters, advocacy information, how to advocate. A lot of great information. A lot of times we share information on our website and our Facebook page for the council from NIDA, NewYorkDisabilityAdvocates.org. There was a meeting with Catherine Garcia back in January, thanks to the support from SOS to make that happen. And it was great to hear that she is a supporter of what we're doing, but she was also concerned about people aging in place and staying out of nursing homes. So that's an area where there needs to be a focus going forward in our world. There are new disability chairs in both houses. Assemblymember Angelo Santa Barbara and Senator Pat Fahey are both big supporters of the IDD population. So that's good that they're both moving into chair roles in the House. The governor's budget, and I think this was mentioned already, the governor's executive budget included a 2.1% rate increase. But again, we're asking for 7.8% because the 2.1% is not keeping up with inflation and the cost of living. NIDA did a survey on vacancy and turnover, and it revealed an increase in both metrics. Statewide vacancy rate as of July was 16.87%, and in January went up to 16.92%. Statewide turnover rate as of July was 31.09%, and then in January went up to 35.37%. So if you're here from an agency and you get the NIDA surveys, please fill them out because it helps get the most accurate data, and it helps with all the advocacy efforts that go on. I know a lot of surveys come out. It requires time, but it's worth it when it comes to what we advocate for and letting the message be clear. Because when we can back up our ask with numbers, it makes it a much stronger ask. IAC DSP Sustainability Project update. Well, it will soon be holding workshops for upper level management, followed by other workshops and events for various levels of staff. OPW news, updated Crow ADM. Although not new, it continues to present challenges for individuals in need of certified opportunities, but not currently in crisis. Providers continue to struggle with vacancies. The link page includes a YouTube informational video for providers. IAC's work group will continue to make recommendations to OPWDD, and this is talking about ADM 2024-03, Certified Residential Opportunities. That's what CROW stands for. There is a new ADM for Pathway, training and rollout for directors. The fees will be increased. And again, sorry if I don't have more details. I'm just going on bullet points that Winnie asked me to share from IAC. This will get much easier when they have a representative back here that can give you all the further details and answer better questions than I can. Timely investigations. This was a big initiative that came out that agencies were alerted starting, I believe, last year. They were getting notices, or I guess report cards is a good way to look at it, on investigations and timeliness of them. Early last year, a formal QI plan was required by Medicaid with only 75% compliance in timely investigations. 86% is the minimum, which will be increasing to 90% as per the federal access rule. OPW is reviewing data in IRMA, which is the incident reporting mechanism online, monthly to note justifications for delays. This will be ongoing. OPWDD's initial review of last year's data shows compliance between 84 and 86%, which is really good improvement from the 75%. For state ed news, continuing issues with the new Atlas system. New York City is aware and working on the issues and accommodations for providers. And that was the end of the updates that IAC provided. If you do have questions, please email me and I will forward them to Winnie to try to get clearer answers and what I would be able to answer on the fly. All right. So next up on our agenda, we have our presentation. Oh, Rochelle, you have a question?
No, and actually just a little comment, point of information. Apparently, 17 states' attorney generals have filed suit to undo the settings rule. I'll let you guess which states they are. It's not New York.
It's definitely not New York yet.
No, it won't be New York, but that's very alarming because even though we might have some concerns about some of the little nitpicky details of some of the things that are in the regulation, the overall regulation about community inclusion as opposed to institutionalization is critical. So keep your ears open for this because this is another point of advocacy. And we need to watch what the courts are going to do.
Thank you, Rochelle. I do want to acknowledge we have Rihanna McKenzie here from DOHMH. She doesn't have any updates, but we appreciate her being here on their behalf, listening to what we have to say, and hopefully bringing some information back to help with our advocacy efforts. All right. Now moving on to our presentations. I didn't see them earlier, but is someone here from Gym Guys? I want to say Anna was the one that was supposed to be here. No? All right. I'll see if what happened and if we can reschedule or get information for you guys. But apparently, just to give them a plug, Anna reached out from Gym Guys. They have a location in Park Slope. They do in-home personal training services. I believe she had originally connected with Doris, who's always involved with the council here. Do you recall this, Doris?
No,
Maybe not.
They came to our resource fair twice.
I know, but she had emailed and said she had connected with Doris, and Doris recommended she reach
Yeah.
out and do a presentation here.
Yeah. But we gave
So
them
we
your
set it up.
information.
Right.
So they do personalized fitness training for individuals with disabilities right in their homes. They have certified trainers. They tailor the sessions to the unique needs and fitness levels of
Mhm.
the individuals. I would have loved to hear more because I don't know if they can go into residences or it just has to be private homes. That would be important to know. But if I can get them to come back or send additional information, I'll find out what happened today and we'll try to get you guys more information.
I will go through what info Christopher and I have, but right now I can't get it because he's in another meeting.
That's fine. But we do have another presentation. We've been booked with 2 presentations every month, so this is great. We have Aisha Green from New York City Department of Health and Mental Hygiene, the Children and Youth with Special Care Needs program. And I know Aisha was here. Oh, there she goes. I see her. I know she was here bright and early. So Aisha, I will turn it over to you. Do you have anything to present that you need me to make you co-host for, or?
Yes.
Okay, let me do that right now.
Thank you. Thank you.
All right, you should see it pop up and you can present.
Okay, let me try to share my slides. And let me know if you're able to see them. Can you see my slides?
No.
No. Okay. Oh, I should have clicked the button. That would help. How
Now
about
it's
now?
loading. Yep, we can see it.
All right, we're in business. Okay, I've never presented in Zoom. So let's see how this works. What about now? Can you see my slides now?
Yes.
Awesome.
We can also see your notes, so I don't know if you want to share that.
Technically no. So let me see. Oh, let me see. I know because get a note. She's telling me I can see your notes. Let's see.
Yeah, if you hit hide presenter view, that might.
That's what I thought. What about now?
Now we just see the slide.
The
Yeah, we don't. Oh no, we
slides.
still see the note at the bottom. If you go
Yeah.
where is it? Slideshow at the top.
Mm-hmm.
I think it's
Yeah.
slideshow.
Okay. Resume slideshow. Let's see. I don't know. Let's try not sharing
Yeah.
again. Try to do it again. Bear with me, folks.
Look, you see a little bit down under use transitions. Go over to slideshow.
Still don't see it.
At the top where it says file, home, insert, design.
Yeah. Yeah,
If you go
I
over the
clicked it. I clicked start from the
No, but if
beginning.
you click on the tab that says slideshow next to
Okay.
animations,
Yep.
it should give you more settings.
Okay. Let's see. Not working.
Oh, it's not pulling up. That's weird.
Can I guess email you my slides and you just click it for me and I can just read from my notes then? How's
You can
that?
do that. You can do
Okay,
that.
cool. Give me a second. I'll do that right now. Sorry, guys. I'm using an in Teams, so this is definitely new for me. If Rihanna's on, hi Rihanna. I work with Rihanna too.
Hi.
Oh, you are there. Hey, girl. Let's see. Copy, email, paste. Okay, coming over to you now, Brian.
Okay. Let me see.
And it's still circling. Okay, it's gone.
Sorry, it gives people a chance to have a bio break. We don't often give those in our meetings. We just go 2 hours straight through.
Yeah, yeah. I just ate my apple while I was listening to you guys. I apologize again. I'll get it right the next time.
I haven't gotten it yet,
Hmm.
but I'm assuming it's because you're coming from secure emails and I get secure emails. So just please
Absolutely.
bear with us. We'll get this going in a second, guys.
Yeah, yeah. I can actually kind of get started. A lot of this is just listening, so we get it together if you don't
Okay.
mind. All
And
right,
worst
great.
case, we can share out the slides after if it doesn't
Yeah,
come through this.
I'll send over the PDF version of it. Yeah. All right. Well, good morning, everyone. My name is Aisha Green. Thank you, Brian, and the Brooklyn Developmental Disabilities Council for giving me this opportunity to present. Again, my name is Aisha Green, Senior Program Manager for the Children and Youth with Special Health Care Needs Program at the New York City Department of Health and Mental Hygiene. During this presentation, I'll be referring to our acronym, which is called SHIN, which stands for Children and Youth with Special Health Care Needs Program, which is a mouthful. I'm going to ask if you have any questions, you can hold that till the end. So our mission of the SHIN program is to improve the system of care coordination for families with children and youth with special health care needs from birth to age 21, who have health conditions for which they need extra health care and assistance.
It's hard to hear you.
It's hard to hear me. Okay, let
Yeah.
me turn my volume up. Give me 1 second. Is that better? Okay, great. So, how do we improve the system of care coordination? We start by establishing trust with the public. Public health has a dark past where individuals with disabilities were frequently subjected to forced institutionalization and harmful medical procedures without consent. And these practices created deep-seated fear among families with public health service that think that we want to potentially harm their children. And SHIN strives to keep open communication between families and public health providers to build trust and ensure the well-being of children with special health care needs. Next slide, please. Some of the barriers families are facing could be systemic issues like lack of access to pediatric specialists, healthcare facilities, and long wait lists. There's also financial burdens, such as including gaps in service and gaps in coverage. There's also cultural challenges like stigmas around disabilities in some cultures, miscommunication due to language barriers or cultural misunderstandings, and past experiences like discrimination or lack of empathy from providers which creates lasting distrust. Historical inequities, further fueling skepticism towards healthcare. By taking steps toward reducing barriers faced by families with special healthcare needs, we can improve their child's quality of life and their well-being. Next slide, please. Next slide, please. So SHIN serves children from birth to 21 who have health conditions for which they need extra health care and assistance. They reside in the 5 boroughs of New York City and have been diagnosed with or suspected of having a serious chronic health condition or disability that could be physical, developmental, intellectual, emotional, and behavioral. If we encounter children outside the 5 boroughs, we can connect them to the closest SHIN office in New York State. The SHIN program provides a variety of services to New York City children. We direct families to testing services or medical specialists by helping families navigate the healthcare system or other delivery systems. We also provide families with a list of doctors, medical specialists that may examine, diagnose, and develop a plan of care for their child. We advocate for their child and provide education materials and web-based resources, such as access to the Department of Health and other New York City programs, information on healthcare expert and medical homes, CDC research and information on medical advancement. We also connect families to health insurance services as we work closely with DOHMH Office of Health Insurance Services. And lastly, we refer families to community programs and resources by collaborating with other organizations, social service systems in the communities that serve children with special health care needs and their families. These organizations may be nonprofit, doctors' offices, religious groups, and they have experience working with children with special health care needs. Some offer services in different languages or different culturally appropriate settings based on the child's and parents' needs. Next slide, please. So during our intake process, we practice active listening. Although our focus is the youth and the child, we find that other family members and caregivers need support or services. Oftentimes, these caregivers are so busy with their day-to-day living and child raising that they may neglect themselves and they don't have time to rest and reset. So I want to read you a quote that really spoke to me as a mom raising a child with special health care needs. And I'm going to read. It says, I think the hardest part of having a child with a delay of any kind is the fight for services, the fight for people to understand who your child is and what they need, the fight for knowledge because knowledge is power, and the fight you have within yourself, wondering if you have left no stone unturned. And if you're a parent or a caregiver or even babysat a child with special health care needs, at some point you've had a day like this person in the picture. And if you have experienced this, remember that there is help out there. And I'll cover some of those resources on the next slide. Next slide, please. Respite services. Again, SHIN can support families getting access to respite services, which allows caregivers to take breaks and ensuring that the children receive safe and professional care. Respite is crucial for preventing a caregiver's burnout and improving the well-being of both parent and child. Next slide, please. SHIN can also connect families to New York City Department of Health, Office of Health Insurance Services, who enrolls New York City New Yorkers from birth to 21 to affordable no-cost or low-cost health insurance and other services. Next slide, please.
Woo!
Parent to parent. Go ahead. So SHIN also refers parents to New York State Parent to Parent, which is a support system of families to alleviate loneliness and empower caregivers and other people with developmental disabilities. It's a statewide organization that helps families connect to other families, and they also have a parent matching program where parents volunteer as support parents to support the caregiver of the child with chronic illness or disability. Next slide, please. SHIN aims to host yearly family engagement forums to empower, educate, and foster a sense of community for which parents and caregivers engage and learn not just from others, but who have been through similar situations, but also from professionals in the field. And we're also having one coming up in April, and I'll share that information a little bit more in the presentation. Next slide. Additionally, we have books that we offer to our enrolled families. Here's one of the 4 books that we send out, which is called Uniquely Wired, to our 6 to 9-year-old readers. It teaches youngsters not only about autism and its gifts, but it also teaches the vital skills of patience and tolerance. Next slide, please. Another book is called Same But Different, which narrates the challenges and triumphs of a teen who has autism and the effects on families and friends. The book was written by 21 Jump Street, the original 21 Jump Street, Holly Robinson Pete, and her twin children, Ryan and RJ has AST. The book is loosely based on their experiences and is for our 12 and up readers. Next slide. Where to Start narrates the most common mental illnesses, which includes a self-help assessment tool, tips on how to get professional help, and how to talk about your mental health with families and friends. And this is for our 12 and up readers. Next slide, please. And finally, the last book is called The Lightning Thief, which is a captivating adventure story on Greek mythology, allowing readers to engage with classic tales while learning about heroism, self-acceptance, and the power of friendship. And a fun fact is that the author, Percy Jackson, series, the author of the Percy Jackson series, excuse me, Rick Royden, is dyslexic. And his personal journey with dyslexia and later ADHD has had an enormous impact on the face of children's literature. And as a writer, his unique perspective allows him to create relatable characters and inclusive worlds for young readers who have struggled with learning disabilities. And this is for our 9 and up readers. Next slide. So the SHIN program receives calls from families of New York City that have a myriad of conditions. This is not an extensive list, but as you can see, we do serve children with a variety of physical, developmental, intellectual, emotional, and behavioral conditions, as you can read on your screen. Cancer, heart conditions, chronic asthma, hearing disorders, speech and language, ADHD, depression, kidney disease, muscular dystrophy, cerebral palsy, and so on, as you can read. Next slide. Here you can see the breakdown of the most prevalent medical conditions triaged within SHIN program. The most cases that are triaged are diagnosed or suspected of diagnosed ASD. These cases make about 37% of our SHIN cases. Of all our cases, 30% of them were children who did not have a specific diagnosis, as this is largely have not been evaluated. Next slide. Most of the intakes processed are from children that identify as male, as 68% cases reported. Additionally, you can see that staff triage cases from Queens, followed by Bronx, and then Brooklyn. Next slide. On this slide, it depicts a breakdown of children in our program, and as you can see, a large majority of the children served are between the ages of 5 and 17. As parents and caretakers become aware of their child's healthcare needs and their children age into kindergarten and elementary school, they may utilize our program to find resources and organizations that can help their children. 61% of our children served by SHIN fall within the 5 to 17 age group, but we do serve children all the way up to the age of 21. Next slide, please. This slide depicts the increase of our reach and demand for services as we continue to network and expand our program over the years, especially post-COVID, where many programs were and businesses and services were closed or reduced. And we doubled down our outreach efforts to meet those needs for services. And as you can see, we've had a huge increase in calls due to our presence in the community. Next slide, please. So what do people call SHIN? Both families and providers call and connect with SHIN for a variety of reasons. And as you can read on the screen, families call for information and guidance, health insurance, medical specialists, social services, home care, respite camps. Providers call to share information about family support services, community partners connected to health insurance, financial resources, or assistive technology. They want to share their information. They want to collaborate. Yeah. Next slide, please. You can connect with SHIN in many ways, reaching out to 311, calling us directly, or scanning our QR code or email. I will share that information later on in the presentation. This is a screenshot of our webpage, as you can see, and we do have an online referral link on our webpage, highlighted by the yellow arrow. Next slide. Here's a sample of the online referral form. A person can fill it out, name, zip code, number, age of the referring child, services you're seeking, language spoken, and how you heard of us. And then one of the call specialists will triage the call, and we will follow up with the referring information. Next slide, please. This slide depicts the referral process post-engagement and how we connect to parents and providers. I would read off the screen, but it's really small. But basically, it just says that there's a referral source like 301, email and webpage. We will do some information gathering. We will check the child's eligibility if they live in the 5 boroughs, if they have a diagnosis, and then we will identify some resources for the child, provide support, and then there's a post-engagement service or survey and a follow-up that we conduct 1 week after we speak with the families. Next slide, please. During the intake process, our SHIN specialists prepare in advance by having a clear understanding of the information that they collect. Start the call with a friendly and professional greeting. We engage in relevant conversation to make the parent feel comfortable before diving into all the questions. We use open-ended questions to encourage detailed responses. For example, can you tell me more about your child's health? And then we follow up with more specific questions to gather precise information and practice active listening. We are patient and empathetic, and we understand that some parents may feel hesitant or nervous So we provide reassurance and acknowledge their feelings. And we also mention that we do not report any of their information to the authorities, which is important in this political climate. Next slide, please. This is just a sample of the intake that we use to collect information. It's about 7 pages. It looks a lot. It's just, shrunken down. But we do submit that to the state for data collection purposes and funding. Next slide, please. So I'm going to breeze through these screens, but this is just some of the examples of the calls that we get into the SHIN program. So a mother of 3 or a child reaches out to the SHIN program seeking information on where to obtain an autism evaluation for her son. The child had participated in the EI program, but had reached the age of transition to the New York City Department of Education Committee for Preschool Education program, which is called CPSC. So we referred the family to DOE website to determine the school district and district coordinator and that the parent should contact. And the SHIN program also mailed the mother a list of community partners that provide autism evaluation and gave her multiple options for organizations to choose from. Next slide, please. Father of an 8-year-old child with severe autism and asthma contacted the SHIN program seeking a home health aide to assist his son with after school. So we referred the father to the New York State OPWDD, multiple care coordination organizations, and pass on information how to apply for SSI for the child. And we mailed the child some SHIN merch. Next slide, please. A family and child with multiple medical needs and insufficient health insurance was referred to SHIN by a community partner. The family was desperate in a desperate financial situation, having used their credit cards to pay for their medical bills. So we referred the family to SSI Income. We connected to SHIN resources and appropriate medical services and culturally sensitive support programs in their neighborhood. And we also mailed additional SHIN merch. Next slide, please. So the New York City SHIN program has been working to develop and publish, increase advertisement and community outreach materials over the past few years to increase program awareness and community presence and partnerships. So our 5 main components of this initiative, including advertisement in magazines, partnerships with the DOH and Early Intervention Program, developing a community partner letter, and tabling at outreach events and social media. Next slide. So in the fall of 2023, we had a really large scale media advertisement campaign that was very successful. We've had some digital print streaming ads in multiple languages. We were also advertising in ethnic and community media newspapers such as AM New York, Brooklyn Paper, Mill Basin, Park Courier, Park Slope Courier, Bronx Time, Noticia, Caribbean Life, Queens Time, and New York Family Magazine. And these advertisements were very successful. We had about 1.4 million total impressions, about over 3,800 total clicks to our webpage, and we're hoping to rerun these ads in the future, but a lot of our funding is tied up in City Hall, again, due to this political climate. Next slide. We've also had some successful advertising with early intervention. They're able to send out monthly or biweekly texts to their entire families that are enrolled in EI, and these were some of the sample texts that went out that was very successful. And we continue to send out those texts every 2 weeks or monthly. Next slide, please. We've also developed a community partner letter that we send out to parents, families, and community organizations and schools. We've been pushing the initiative to send out mailers with our program's palm card, partner letter, and books and resources to introduces the program and the services we provide. And there's a prompt for us to work together to help New York City children receive services that they need. Next slide, please. The SHIN programs loves to participate in health fairs and other community events. We display our programs materials, information, and ways to contact us. And as you can see, we're honored to take a photo with Brooklyn's own U.S. House Minority Leader, Hakeem Jeffries. And we're hoping to go to the one in East New York next month. Shameless plug. Next slide. We've also been highlighted on our agency X platform, formerly known as Twitter, and these were some of the posts that went live in the past for March's Developmental Disability Month and February's Dental Awareness Month. Next slide, please. This is our programs that team that are currently on staff. We have a few more not listed, but they're like part-time interns. But you have myself, Geraldine Romero, who's on the line with us, Carla Hernandez Paz, our intake coordinator, who typically answers the phones or call you back along with Maria. We have Dr. Danielle as our program evaluator, and Daniela Torres, our initiative coordinator, who keeps us all afloat. Next slide, please. This is how you can contact us. Feel free to screenshot, write our number down. That is our email address, scan the QR code. We actually call you back with less than 48 hours, and you do get a live voice on the phone. Next slide, please. And we are having our first family engagement forum coming up in April 4th, here at the Long Island City, what we call Gotham Department of Health. Here on the 12th floor, we're going to be having some speakers and parents to come out and share their perspective on raising a child with ASD. We're hoping that you will participate in attendance. There's not an opportunity to table, but you can bring your materials. We will have a table to display your materials. And we also have one coming up in May as well. I'll put all that information in the chat where you can click the Eventbrite link and register for both web forums for April and May through Eventbrite, and it'll be also virtual and in person. Next slide, please. And thank you. Thank you for inviting us. Thank you for listening to my long-winded presentation. I do have a post survey that I would appreciate you guys to fill out. I'll drop that link in the chat. And if you have any questions, I'll take them now. No questions? That means I covered everything.
Aisha, this is Carrie Banks from the Brooklyn Public Library.
Hi, Carrie.
How are you?
Good.
That was a great presentation. I had no idea about
Thank
this
you.
program, and I'm usually pretty good at stuff like this.
Oh, awesome.
So I have a whole list of questions for you.
Good.
But
Yes.
the first one is, do you have resources for parents who have health insurance through their work, who are having trouble getting their children's care covered or approved?
They sit right behind me. Yes.
Okay. Some, because that's a huge issue, as I'm sure you know.
Mhm.
Actually, I only had two questions. Oh, no, three. The second is, what languages does your staff speak?
Currently, they all speak Spanish, but we do utilize the language line.
Cool. And finally, you had said at one point that you don't ask about status. And then later on, you mentioned that you send the referral forms to New York State. And I'm wondering when you do that, if they are anonymous or if they have the family's names on them, because New York State does sometimes check status, even retroactively. So
Yes. So for the purposes of this, we do not report status. We do collect the parent's name and information, the same, email address and everything, but that is not reported to the federal government. It's used for like New York State profiles. To create those profiles is used for funding through federal government. I'm trying to think of my grantor's name, Title Block 5 funding.
yeah. Okay.
But no, we don't report status. Absolutely not.
Great. All of that is really helpful information. Now I'm just kind of going through the things that we do and how we can fit you in.
Yeah.
But we would love to host one of the forums, networking forums, if that's of interest. We have great spaces and they're free. And we'd love to also invite you. You're certainly welcome to come next week, but that's really focused on adults. But we have a children's one in September.
Okay.
So
Well, we have 18 and 21 as well, so they're technically adults. We do serve.
Perfect.
Yeah, young adults.
All right. Thank you. This
Yes,
was great.
I'll put my information in chat and feel free to reach out directly or through our email. Yeah.
Great. Thanks again.
You're welcome.
All right, you have a question from Debbie Greif.
Hello. As the chair of the advisory council, I want to ask you something I think you really need to be careful about. If the parents are working, their kids are not going to get SSI.
Okay.
Because it goes by, once it's under 18, it's the parents, this is not my rules. It's the parents' responsibility to support their children. That's why we fought very hard to get what's called the Medicaid waiver, which then will waive the parent's income. So, because when you sit about you help family get SSI, a red flags warning went right up in my brain, because I also want you to be aware, even though you may not report status, once the name is, they will check and investigate. And if the child is not, if they're, it's not my rules, but this current climate, they're going to check. So I'm not saying I don't want
Absolutely. Yeah,
children
we
help, but I
refer them
want
to
you,
SSI. Yeah, we don't do the application. We actually just
yeah, but
give
I
the
want you
information.
to understand that they cannot, you cannot get SSI unless the parents' income, either if they're on SSI themselves or public assistant, yes, they can get, most likely the children will get it. But if they're not and the parents are working, they will not get SSI. Yes, it is very expensive to take care of children with disabilities, whether developmental or others. But at the same time, they will not. I have had to help many families and explain to them about the SSI ruling. And I really hope you really explain this to the families, because it's very unnerving to be in that office, sit there for hours and try to fill out the forms. And then when they find out mom or dad are working, nope, they won't take you. I want you to be
Yes,
completely understanding what I'm saying,
absolutely.
because I have
Yes.
helped many families, and it is a very daunting, scary process. And with the
Yes.
current administration, we do have issues. And yes, we'll try to have you at one of our resource fairs, and also have you do one of the meetings with us. We do virtual
Awesome.
to make it easy for many of my families who have to work. All right, thank you.
Thank you, Debbie, for clearing that up. Appreciate it.
You're welcome.
And there was one other question in the chat, but I see you just answered them about on-site workshops.
Mhm.
And again, this is being recorded, so it will be posted on our website, and I can share, if you're okay with it, I can share a PDF version of your slide deck on the
Yes, I'll send that
website if
over to
people
you.
want to refer back on, especially for contacts and how to get more information.
You got it. Coming over right now.
Any other questions for Aisha? All right, I don't see any. Thank you so much for joining us and for presenting. That was
Thank you
great.
for having us. Thank you.
And feel free to join any of our future meetings
You
and
got
share
it.
any updates or workshops. Definitely share workshop flyers with me. I pass them out and I'll get it to our mailing list.
You
We
got
have
it.
almost 700 people now on it throughout Brooklyn. So
Hi, do you guys hear me?
yes, we can hear you.
Okay, I couldn't find the raise your hand feature. Hold on a second. Okay. Hi, my name is Melinda. I'm the intake coordinator for New Horizon Counseling Center for our developmental disability portion. I didn't really have a question, but I wanted to know, is it possible you could email me that flyer for the April 4th event? Because I do know a lot of families that have young children that need these kind of services and want more information, but don't know where to go. I could type my email in the chat if anything.
I'll put everything in the chat right now. Give me 2 seconds.
Okay, perfect. Thank you so
Got
much.
it. Mhm.
Thank you.
All right. Well, thank you again, Aisha. Appreciate it. I don't see any other hands. I'm going to circle back real quick. Did anyone from Gym Guys show up? Going once? Going twice? Sorry, another meeting. All right, so now we'll open the floor to announcements. Actually, I'll start it off. I completely forgot at the beginning. Save the date, June 18th, Brooklyn College, the Brooklyn Council Family Support Fair. That is our plan right now, Wednesday, June 18th, from 9:30 to 2. Just worked on it. I was on vacation last week, so just started working with them to get some dates. So nothing has been sent out yet, but you will get save the dates, you will get sign up, all that good stuff that you guys got inundated with last year to get registered and get tables and to sign up to attend. We will get that all going in the very near future. So please just save the date. Wednesday, June 18th will be the Brooklyn Family Support Fair back at Brooklyn College. All right. And Paula, I saw your hand first.
Hi, good morning, everyone. Paola Martinez, Bond, New York Lawyers for the Public Interest. And Reminder that New York Lawyers for the Public Interest is a nonprofit legal organization, and we do have a big disability justice program defending the rights of people with disabilities. We also provide a lot of free trainings for families. So in April, we're going to have our semi-annual Know Your Rights to Special Education workshops, English and Spanish, and English will be April 15th, Spanish will be April 17th, and I'm posting the links for people to sign up, register, or send it to other people. Thank you.
Thank you, Paula. Carrie.
Hi. It's good to see everybody. I just wanted to remind people about the fair that's been mentioned several times now at the New Lots Library. It's on March 14th. It's coming up around the corner. It's amazing. From 11 to 1, and it is mostly focused on the needs of adults with developmental disabilities. We are very excited to do this. We don't often do things at the New Lots Library. And if those of you haven't been there recently, it's a very nice library. And we hope to see you there. We also next month have our regular one-to-one assistance navigating disability systems with Include NYC, and that is on March 4th, I believe. Wait, no, am I getting that right? March 5th, sorry about that. So this is where individuals with disabilities or families of individuals with disabilities can get a phone call from a phone meeting with Include NYC to discuss things like maybe issues with the IEP or eligibility, their child's eligibility for services. Or, I mean, Ruth has been known to go line by line through an IEP with a parent who's having difficulty there, or, how to get missing services, and other things that they are eligible for. So that's on.
Carrie, one issue. Even though we have services for adults, we're also on March 14th, children also, because OPWDD is there to make sure we sign families up for their children under 18. Just wanted to say that because it's not just geared only for adults, geared for both. Thank you.
My apologies. I meant that the focus is on adult services, but of course, we're always there for children and sign them up and things like that. Yes. This used to be the Child's Place for Children and Teens with Disabilities. So and I'm a children's librarian at heart. So,
I know, but it's going to be.
Thank you for
everybody.
Yeah, thank you. Appreciate that.
You're welcome. Thank you.
So the one-to-one assistance that's on March 5th. That's a Wednesday. And if people want to make an appointment, they can email me or give me a call. I'll put my information in chat. Thank you very much.
Thank you, Carrie. Doris?
Hi, everyone. My name is Doris Kahn, and I'm the Outreach Coordinator for the New York State Institute on Disability. We're a family support agency, and we have openings for evaluations for individuals who live in the Bronx, Brooklyn, Queens, and Staten Island, and who do not have Medicaid. And the purpose of the evaluation is to obtain OPWD eligibility. Please contact Elizabeth Sunshine at 917-699-0578, or you can email Elizabeth at esunshine@nicetinc.org. NICET also provides behavior management services for individuals who live in Brooklyn, Queens, and the Bronx. If the individual has self-direction, we cannot provide those services. If you are interested, contact Juliet Hawkins at 917-524-4856, or you could email Juliet for more information at jhawkins@nicetinc.org. NICET also provides reimbursement for individuals living in all 5 boroughs. Please contact Jackie Tripodi at 929-202-1115 or Tripodi@nicetinc.org. NICET also provides transportation for individuals who live in the Bronx, Brooklyn, and Staten Island and do not have self-direction. for medical appointments and recreational outings. Contact John O'Grady at 917-747-9427, or you can email John at jogrady@niceinc.org. NYSID also has tickets for different venues for recreational purposes for individuals who live in Brooklyn, Queens, and Staten Island and do not have self-direction. Contact Sarah Alton at 718-494-6457 or salton@nicidinc.org. Thank you, and I put the flyer in the chat, Brian, with all the numbers and email addresses. Thank you very much.
Yes, and this will all be posted on our website, the chat and the video after the meeting, usually within 24 hours. Thank you, Doris. Sandy.
Hi, everyone. Hope everyone's having a good day. I just want to let you know about some exciting ADAPT webinars that are coming up soon. We're going to have one this Thursday, Auditory Processing Disorder, Setting Up Your Child for Success. And it's going to be this Thursday, February 27th from 10 a.m. to 11:30 a.m. You'll learn how this disorder can impact a child's learning, how it is assessed, and how it can be treated. Also coming up on March 6th, 10 a.m. to 11:30 a.m. is intellectual disability. What is it? How is it diagnosed? And how does it differ from a learning disability? Dr. Myra Alvarez will be our speaker. Also on March 13th, we're having a free webinar, A Roadmap for Equity to Autism Diagnosis and Care. Dr. Kate Wallace will be our speaker. It's March 13th, 10 a.m. to 11:30 a.m. And you can register for all of these at Family Connect and adaptcommunitynetwork.org or call us at 718-436-7979, extension 5139. We always provide Spanish and Mandarin interpretation, and I've dropped some of the flyers in the chat. Thanks, everyone. Have a great rest of the day.
Thank you, Sandy. Carrie?
Yeah.
I forgot. My apologies. We have a bilingual concert on March 22nd at the Sunset Park Library. This is an autism-friendly concert. And of course, it's free. And I've got the information in English in the chat, half of it in Spanish, and I'm putting the other half of the Spanish in the chat now. So, so please share this widely. It's an amazing opportunity. These are all autism and sensory-friendly concerts. That we do in partnership with Music for Autism. So I look forward to seeing some of you, I hope, at the Sunset Park Library on March 22nd. Thank you. I won't, even if I forget something, I won't come.
You're more than welcome. Thank you. Mary?
Hi. Okay, I'm not on mute, right? Okay.
No, we can hear you.
Okay, beautiful. Hi, everyone. I'm Mary Elstone. I work for American Home Care Services, and we provide home health aid for children and for adults who have OPWDD. We provide also OT, PT, speech therapy, ABA services, ComHab, and respite. I'll put my information on the chat. We accept straight Medicaid and also managed Medicaid. So I'm putting all my information and a flyer attached to in the chat here.
Thank you.
Thanks.
Pat.
Good morning. Good morning, everyone. Pat Liu, Family Support Coordinator from GHO. So, Family Support, GHO's Family Support Service we have available for an individual who is seeking for OPWDD service and who is new to the system. And our staff can speak Chinese and Korean. And this Family Support Case Management Service, Medicaid is not required. So we encourage the family, if you are new to the system, who have a question, how to proceed OPW eligibility, and to understand what's CCO, we can help. And for the day service, we have a day help, site-based day help, and day help withdrawal and job training program available. And finally, GHO has a contract with CDNY. We have intake assistant for the family who speak Korean or Chinese. And my contact information I put on the chat. So please reach out. Thank you.
Thank you, Pat.
You're welcome.
Erica?
Hi, good morning, everyone. My name is Erica Thorpe. I am the intake coordinator for Heaven's Hands, and we currently have openings in our Brooklyn locations, both Sunset and at our East 98th Street location. We are also offering tours. So if you have parents that are interested in tours or you have care managers that are interested in tours, they can definitely contact me via email. That's the best way so that we can all stay on task. My email information is located in the chat, as well as we have respite and community rehabilitation available. So if you're interested, please get in contact with me. Otherwise, everyone have a great rest of your week.
Thank you. I see some hands, but I think it's just people didn't put them down. Is there anyone else that I missed for any announcements? All right. I think you guys will get about 15 minutes back in your day. Make good use of it. Thank you, everyone. I will
Thank
post
you. Have
the
a good day.
video in the chat on our website. And if anyone has any questions, you can email me and I'll get it out to the group. Take care.
Take
Thank
care,
you.
Brian.
Have
Thank
a good day,
you.
everyone.
Bye.
Bye-bye.
Bye.
Thank you, everyone.
Bye.
Bye.
Bye. Thank you.